We've started this, and a small portion of this part is remaining towards the end of the lesson. We'll go through this like hypo and hyposecretion of thyroxine, disorders of thyroid gland, um, of which first one is hypothyroidism. That is disorders that arises due to the lesser production of thyroxine. It is caused by the deficiency of thyroid hormone or removal of thyroid and thyroid, thyroidectomy. Thyroidectomy is the technical term used for it. Caused by the deficiency of thyroid gland or thyroidectomy, removal of thyroid gland. One of the disorder, generally they are not called as diseases. They are called as disorders. First disorder is cretinism. Hyposecretion of thyroxine in children leads to cretinism. If the thyroxine is produced in lesser quantity in children, it causes cretinism. The patient shows low basal metabolic rate and low oxidation. Low oxidation means oxidation of energy-rich nutrients like carbohydrates, proteins, and fats, especially carbohydrates and fats. Due to this, energy production is comparatively less. The individual suffering from cretinism shows stunted physical growth, mental retardation, and delayed puberty. Stunted physical growth means growth of the child will be less than his or her age. And mental retardation means mentally unsound. Even though the child is of 18 or 19 years old, the development of the brain will be equal to that of a child having 6 or 7 years old. And delayed puberty, that means generally individual attains puberty at the age of 13 to 18, but these children attains puberty late in their developing age. They show dry skin, thick tongue, prolonged neonatal jaundice. Dry skin is always dry for this individual. Tongue is protruding as well as thick tongue. And prolonged neonatal jaundice. Prolonged neonatal jaundice means right from the birth, a cretin shows jaundice, and it remains in their body for a long period of time. Long period of time means till the age of 3 or 4. Just after the birth, they start with the jaundice, and it will remain till the year of 3 to 4. Lethargy and constipation are the other important symptoms shown by this individual. So cretinism arises due to the hyposecretion of lesser secretion of thyroxine in children. May result in low BMR, low basal metabolic rate, and oxidation. Shows stunted physical growth, mental retardation, and delayed puberty is another symptom. They show dry skin, thick tongue, prolonged neonatal jaundice, lethargy, and constipation. This can be treated by early administration of thyroid hormones. If it is detected in the very beginning, it can be treated and cured to an extent. 90 to 99% curable by administration of thyroid hormones. Next one is Mixodema. Mixodema is hypothyroidism in adults. The deficiency of thyroid hormone in adult causes Mixodema. The patient shows peculiar thickening and puffiness of skin and subcutaneous tissue, the tissues which are below the skin, particularly of the face and extremities. Extremities means the tip of the leg, tip of the hands, etc. They are called as extremities. Patient shows peculiar thickening and puffiness of skin and subcutaneous tissue. Subcutaneous matlab sub means niche, cutaneous means skin. The tissue below the skin shows puffiness, so that it appears that the entire body appears to be puffed up. Patient shows low mental alertness and loss of memory. Loss of memory in the sense it is not loss of memory like dementia. It is loss of memory in the sense unforgetfulness. That type of loss of memory. The patient suffers from low heart rate, low BP, intolerance to cold, always feeling cold. Low body temperature and retarded sexual development is also observed in some patients. This will come only for 2 mark students. Write notes on Mixodema. Any 4 symptoms you have to write, but remember that you have to mention Mixodema is a disorder that arises due to lesser secretion of thyroxine in adults. Cretinism is lesser secretion of thyroxine in children. And symptoms of cretinism: retarded mental growth, retarded physical growth, low BMR, protruding tongue, thick tongue, dry skin, and delayed puberty. They also show some constipation as well as lethargism. Then Mixodema in adults: low BMR, low blood pressure, intolerance to cold, then puffiness of skin, development of subcutaneous, thickening of subcutaneous tissue, etc. Simple goiter, iodine deficiency goiter. Iodine deficiency in the diet causes enlargement of thyroid gland, leading to simple goiter. This disease is common in hilly areas. Addition of iodine to tablet salt prevents this disease. Size of the thyroid gland is increased, but total output of thyroxine is reduced. That is a key point. That is, size of the thyroid gland is increased, but total output of thyroxine get reduced. Actually, simple goiter is never included among hyperthyroidism or hypothyroidism. Is a disorder that arises due to the deficiency of iodine in our diet. As we have seen that the follicles of thyroid gland produces thyroglobulin. Thyroglobulin along with iodine gives us thyroxine. If our body cannot provide the proper amount of iodine, then thyroxine is not synthesized. So in the absence, generally the patient develops a disorder called as iodine deficiency goiter. The main symptom of iodine deficiency goiter is enlargement of the thyroid gland and subsequently enlargement of the neck region. Iodine deficiency in the diet causes enlargement of thyroid gland, leading to simple goiter. The disease is common in hilly areas where the availability of iodine in their diet as well as in the soil is less. So the vegetables which are grown in the soil contains less amount of iodine. When they consume it, iodine deficiency symptoms arises in their body. Addition of iodine to table salt prevents this disease. Table salt means common salt which we use for our household cooking and other purposes. Size of the thyroid gland is increased, but total output of thyroxine is reduced. It appears that a larger thyroid gland, so naturally more amount of thyroxine should be produced. No. Thyroid gland, the number of follicular cells in the thyroid gland will increase. That is the reason. So whatever notes are given, that you have to remember any 4 symptoms as well as control measures. Enlarged thyroid gland, a small diagram is given. Then hyperthyroidism. It is caused by increase in level of thyroid hormone. This increases metabolic rate, sensitivity, sweating, flushing, rapid respiration, etc. Increases high metabolic rate. That is, there is increased BMR. Sensitivity बोले तो hyperactive रहता है. Hyperactive means it appears that the person is highly sensitive. but the person is not highly sensitive, the person is hyperactive. That is the reason. Sweating, because basal metabolic rate is high, oxidation of nutrients are high, so large amount of energy is generated, so automatically body produces large amount of heat and thereby sweating. Flushing, rapid respiration, rate of respiration is more in these persons. In some cases, the eyeballs bulges out. There is bulging of the eyeballs and affects various physiological activities. Hyperthyroidism. It is also called as the disease that arises due to hyperthyroidism is generally called as Graves' disease. Another name is exophthalmic goiter. Excessive secretion of thyroxine, that is hyper, in adults leads to Graves' disease. Symptoms include increased BMR and weight loss. Weight loss. Increased heartbeat, increased blood pressure, higher body temperature, nervousness, irritability, tremor of fingers are also observed. ऐसा tremor of fingers बोले तो finger ऐसा shivering जैसा लगेगा. That is also due to increased basal metabolic rate. So in exophthalmic goiter, exo means outside, ophthalmo means eyeball. Eyeball bulges out. That is called as exophthalmic goiter. Exo means towards outside, ophthalmo means eyeball. There is bulging of eyeballs due to deposition of fat in the eye socket. Behind the eyeball, in the eye sockets, there is deposition of fat. So the eyeballs projects out. That is called as exophthalmic goiter. A diagram of exophthalmic goiter where bulging of the eyeball is seen. So what is Graves' disease or exophthalmic goiter? Graves' disease or exophthalmic goiter arises due to hyperthyroidism, increased secretion of thyroxine in adults. Leads to this disease. Symptoms include increased BMR and weight loss, increased heartbeat, increased blood pressure, higher body temperature, nervousness, irritability, tremor of fingers are also observed. In exophthalmic goiter, there is bulging of eyeball due to deposition of fats in the eye sockets. That means eyeballs will bulge out due to the deposition of fat behind the eyeball. Exophthalmic goiter. Now we have the next hormone called as calcitonin. Thyrocalcitonin. How many hormones are secreted by thyroid gland? Two hormones. One is thyroxine and the other one is thyrocalcitonin. Thyroxine is secreted by It is secreted by the follicular epithelium or epithelium, which lines the thyroid follicles, while calcitonin is secreted by the C cells or parafollicular cells, which are present between the follicles. As we have seen in the diagram of TS of thyroid, we have seen that thyroid follicle, and it is the thyroid follicle that is responsible for the production of thyroxine, while in between the follicle there are isolated group of cells. Those isolated group of cells are responsible for the production of hormone called as calcitonin. Another name is thyrocalcitonin. The hormone is secreted by C cells of thyroid gland. C cells means clear cells. They are also called as parafollicular cells. It regulates the concentration of calcium and phosphorus in the blood. It can maintain the balance of calcium and phosphorus in the blood. Hence the name calcitonin. It is under feedback control of plasma calcium concentration. Control of plasma calcium concentration in blood. Please correct. That is It is under feedback. It is under feedback control of calcium concentration in blood. This will be blood, please. While sending the PDF, I will correct. This under feedback control of plasma calcium concentration in blood. If that means if the amount of calcium in the plasma is high, thyroid gland will stop producing calcitonin. If the level of calcium is low, thyroid gland will secrete calcium, or vice versa. Like amount of calcium in the blood is high, thyrocalcitonin will not be produced, and it is low, thyrocalcitonin will be secreted. That is the feedback control. The hormone is secreted when the concentration of calcium rises in the blood. It lowers the concentration of calcium and phosphorus in the plasma by decreasing their release from bone and accelerating the uptake of calcium and phosphorus by the bone. It lowers the concentration. If thyrocalcitonin is more in the blood, it will prevent the concentration of calcium and phosphorus in the blood. How? By decreasing the release from the bones and accelerating the uptake of calcium by the phosphorus and bones. Remember one point, students. That is, what is the main function of calcitonin? Main function of calcitonin is to lower the level of calcium in the blood. By lowering the level of calcium means it will influence the bones to uptake the calcium. When the calcium and phosphorus are uptaken by the bones, automatically the level of calcium will get reduced in the blood. So this hormone is also called as hypocalcemic hormone. Another name for this hormone is hypocalcemic. The primary function is on the bone. That is, it is essential. This hormone is essential for the absorption of calcium from the blood and its deposition on the bones. That is in one word, what is the function of calcitonin? The main function of calcitonin is to act on the blood and influence the blood to deposit the calcium on the bones and prevent the loss of calcium from the bones. Okay. So that is thyrocalcitonin. Thyrocalcitonin, this hormone is secreted by C cells of the thyroid gland. It regulates the concentration of calcium and phosphorus in the blood. It is under the feedback control of plasma calcium concentration in blood. This hormone is secreted when concentration of calcium rises in the blood. It lowers the concentration of calcium and phosphorus in the plasma by decreasing their release from the bones and accelerating the uptake of calcium and phosphorus in the bones. See, students, when you consume more amount of calcium containing food, the calcium will go into the blood. So thyrocalcitonin is secreted, and thyrocalcitonin will influence our bones so that the bone will take up the calcium, and the level of calcium in the blood get lowered. So this hormone is also called as hypocalcemic hormone. Another name is hypo. This hormone is also called as hypocalcemic hormone. Hypocalcemic. Hypocalcemic बोले तो it lowers the hypocalcemic hormone. It lowers the level of calcium in blood. How it lowers the level of calcium in blood? It influences the bone to take up the calcium. Calcium को absorb करने को बोलते हैं bones को. So the bone will absorb all the calcium and phosphorus. The level of calcium will come down. Okay. So that is the point here. Thyrocalcitonin will come only for 2 marks, students. What is thyrocalcitonin? It's a thyroid hormone secreted by C cells. What is the main function? It is a hypocalcemic hormone. Why it is hypocalcemic? Because it reduces the level of calcium in blood. How it reduces the level of calcium in blood? It influences the bones to absorb calcium and phosphorus from the blood. Okay, with this, we complete the thyroid gland. Now wait for a minute. We will go to the next gland and the presentation. Please wait for a minute. So, thyroid gland, many questions are possible from thyroid gland, students. It is important from structure to thyrocalcitonin. Thyrocalcitonin will come only for 2 marks. What is thyrocalcitonin? What is the main role? Remember a point, thyrocalcitonin is called as hypocalcemic hormone. The word is going to come again in this unit. Now parathyroid glands. Parathyroid gland is situated on the posterior surface of the lobes of thyroid gland. They are embedded. There are 4 parathyroid glands. 4 parathyroid glands are there and they are embedded in the thyroid lobes. Thyroid lobes के अंदर fixed रहते हैं these glands. Glands are embedded. If this is the thyroid gland, these are embedded in the posterior lobe of the thyroid gland. Fixed. They are 4 in number and named as superior and inferior parathyroid glands. This is the lobes of thyroid gland. You have the parathyroid glands like this, superior lobes as well as the inferior lobes. There are 4 in number. They are superior and inferior parathyroid gland. This is a superior parathyroid gland. This one is a superior parathyroid gland. And these 2 are inferior parathyroid glands. Okay. So that is the point which you have to remember. The cells of these glands are arranged in compact mass. Cells are very compactly arranged as a group of cells. Parathyroid secrete a peptide hormone. Peptide hormone means protein-based hormone. Protein hormone, that is peptide hormone. A protein hormone secretes a protein-based hormone called as parathormone or PTH, or it is also called as Collips hormone. Collips. Parathyroid gland secrete a peptide hormone called as parathormone or PTH or Collips hormone. That is another name. This hormone regulates the calcium and phosphate balance between blood and other tissues. So some crucial points or important points are going to come here. Release of PTH increases calcium level. Release of parathormone increases blood calcium level. That is the point. Calcitonin, release of calcitonin decreases the level of calcium in blood. Level of calcitonin, अभी हम लोग just discuss किया था calcitonin. Calcitonin calcium का level को decrease करेगा और a parathormone calcium का level को increase करेंगे. It increases the level of calcium in blood. PTH. It draws calcium from bones and increases calcium absorption in the digestive tract and reduces loss of calcium through urine. Suppose it influences the bones to release calcium from the bones. Bones के अंदर से calcium को release करने का, and it will come back to the blood. So the level of calcium can increase. And of course, an absorption of calcium in the digestive tract. When you consume food and food contains calcium, this calcium will be absorbed by the digestive system always in the presence of PTH and reduces the loss of calcium in the urine. If nephron senses that calcium is lost through the urine, that also is prevented by the PTH. Means somehow this PTH is going to increase the level of calcium in the blood. अभी तुम्हारा डाउट ये रहेगा ब्लड के अंदर कैल्शियम क्यों चाहिए? Calcium and all sort of ions must be present in the blood. If this and they will act as a solute in the blood. Because of the presence of the solute, the osmotic pressure of the blood increases. When osmotic pressure of the blood increases, along with that blood pressure also can be increased or normalized. If the solute concentration in the blood is low, blood pressure also becomes low. So in order to maintain constant blood pressure, there should be constant amount. In order to maintain a constant blood pressure, there should be constant amount of solute in the blood. And the solutes are nothing but calcium ion, phosphorus ions, etc. ब्लड के अंदर कैल्शियम नहीं रहेगा तो ब्लड का ऑस्मोटिक प्रेशर कम हो जाएगा. ऑस्मोटिक प्रेशर कम होते हैं तो ब्लड का प्रेशर भी कम हो जाते हैं. So in order to maintain that, calcium should be always present in the blood. And this hormone is essential for maintaining the level of calcium in the blood. It draws calcium from bones, increases calcium absorption in the digestive tract, and reduces the loss of calcium in urine. If calcium is lost through the urine, it will reduce it. So secretion of PTH is under the feedback control of blood calcium level. Same, if calcium level is less, PTH will be secreted, and calcium level is high, PTH secretion will be stopped. Concentration of calcium and phosphorus. Hello, any problem, students?
So can we say that the calcium in the blood is necessary in the means that in the nerve impulse through synapse, calciums are necessary to open the voltage, to open the synaptic vesicles.
I understood. Yes, boy. Yes, student. I understood. Is absolutely necessary. You know, when a nerve impulse reaches the axon terminal, that is the presynaptic terminal, the first activity that going to happen is the opening up of calcium ion channels. Those calcium ion channels open, they enter into the presynaptic terminal. Then the vesicles containing the neurotransmitter will dock on the docking protein present on the presynaptic terminal. That is some वो एकदम पर्टिकुलर हो गया. मैं जनरली डिस्कस करता हूं. अभी सिंपल वर्ड में कोई पूछे क्यों कैल्शियम चाहिए ब्लड के अंदर, वी नो इट सिंस वी हैव लर्नड. हम लोग स्टडी किया ना, इसीलिए आपको मालूम है. आप अच्छा से स्टडी किया, आपको मालूम है. इसीलिए कैल्शियम, बिना कैल्शियम से नर्व इंपल्स ट्रांसमिशन नहीं होगा. एक आम आदमी पूछ रहे कैल्शियम क्यों चाहिए हमको ब्लड के अंदर. सिंपल वर्ड, कैल्शियम तो बोन्स बनाने के लिए, टीथ बनाने के लिए सब चाहिए. उसके अलावा कैल्शियम ब्लड का ऑस्मोटिक प्रेशर मेंटेन करने में लिए भी चाहिए. दिस इज अ वेरी essential element. It is not only essential for maintaining the blood concentration, solute concentration, nerve impulse transmission, but asked is a correct one. But generally speaking, calcium का role क्या है? It is essential for maintaining the osmotic pressure and blood pressure. Okay, so that is right. बिना calcium से nerve impulse transmission is impossible. But generally speaking, when we concern about body fluid concentration of ions, calcium plays a very vital role. So concentration of calcium and phosphate is maintained by PTH and calcitonin. They form an antagonistic pair. Antagonistic pair बोले तो क्या? We have PTH and calcitonin. If ध्यान से सुनो, if calcitonin is more in the blood, calcium level will come down. If amount of PTH is more, calcium level will increase. दोनों का activity opposite हो गया. So it is called as a what? Antagonistic pair. Concentration of calcium and phosphate is maintained by PTH and calcitonin. When calcium and phosphorus level drops in the blood, PTH will come into the picture and increases the level of calcium and phosphorus. When the level of calcium and phosphorus increases, thyrocalcitonin will come into the picture, reduces it. And ekdam reduce nahi karte. When if the person is an adult healthy human being, the amount of PTH production and amount of calcitonin production is always in वन टू वन कॉम्प्लीमेंट्री रहते हैं, मैचिंग रहता है, इतना ये प्रोड्यूस करेगा तो इतना ही ये प्रोड्यूस करेगा, प्रोवाइडेड द पर्सन इज healthy. Okay, and the functioning of thyroid gland and the parathyroid gland embedded in it is normal. So concentration of calcium and phosphate is maintained by PTH, and calcitonin forms an antagonistic pair. There are many antagonistic hormones in the body. One such hormone is PTH and calcitonin. Hyposecretion of PTH lowers calcium in the blood. Hyposecretion, इधर देखो, hyposecretion, less PTH means less calcium, more PTH means more calcium. Okay. Hyposecretion of PTH lowers calcium in the blood. This increases excitability of nerves and muscle, causing muscle twitch, spasms called parathyroid tetany or hypocalcemic tetany. अभी come to the point. मैं उधर है ना generally बताया था blood pressure related. Now एकदम particularly point आ गया. This increases excitability of nerves and muscle, causing muscle twitch and spasms. Spasms बोले तो sporadic spasms, बोले तो continuous contraction of muscles है, continuous, because of the abnormal availability of calcium. कभी calcium increase हो जाएगा, कभी calcium decrease हो जाएगा. Due to the abnormal availability of calcium, there will be abnormality in muscle contraction, and that is called as a spasms or muscle twitch. And this is called as a parathyroid tetany or hypocalcemic tetany. Hypocalcemic tetany and parathyroid tetany are, even though they are genetic, it can be controlled by using calcium containing medicines. This increases excitability of nerves and more calcium and less calcium, as one of the student has opinion that they are very essential for muscle contraction. So here this point is also mentioned again. This increases excitability of nerves and muscle, causing muscle twitch. Muscle twitch means contraction of muscle, abnormal contraction of muscles रहते हैं, spasms, and called parathyroid tetany or hypocalcemic tetany. Hypersecretion of PTH is responsible for absorption of more calcium from the blood. अभी देखो बॉडी के अंदर PTH का secretion ज्यादा हो गया तो क्या करेगा, more calcium will be absorbed from the bones. वो calcium को ढूंढते जाएगा. This hormone will be searching for calcium to absorb. So the main storage structure for calcium in our body is the bones. Abnormally our body is producing PTH. PTH ज्यादा produce हो रहे because of some unknown reasons or because of some known diseases का वजह से PTH का production ज्यादा हो रहा है. तो क्या करेगा, PTH will search for calcium and the storehouse of calcium is the bone. पूरा bone के अंदर से calcium को absorb करना चालू करेंगे. You know the condition that arises when calcium, more and more calcium is lost from the bones. The bone becomes thin, it becomes fragile, it becomes breakable, and it loses its strength. ये सब हो जाते हैं. This results in demineralization of bones. Demineralization of bones means more and more calcium will come out of the bones into the blood, resulting in softening of the bones, bending of the bones, and fracture of bones called as osteoporosis. Osteoporosis. What is osteoporosis? It is bending, fracturing, fracture, and softening of the bones. Why it arises? It arises due to demineralization of bones. What is one of the reasons for demineralization of bones? It is absorption of or release of calcium from the bones. Why the calcium is released from the bones? Because it is needed in the blood. Why it is needed in the blood? Because we have a hormone produced in large quantity in the blood called as parathyroid. Means demineralization blood. Softening, bending, and fracture of bones called as osteoporosis. It is common in women who reached menopause. Means once the once a woman reaches the final stage of her reproductive cycle, when she loses her ability to reproduce, we call it as menopause. In menopause, female, this hormone osteoporosis is observed. Over there, many other reasons are there, because that is related to the production of reproductive hormones like progesterone, estrogen, luteinizing hormone, etc. They are also related there. But osteoporosis is observed in women who attain their menopause. Okay, so these are the points which you have to remember in the uh, parathyroid glands. What do you know about parathyroid glands? There are 4 glands. They are superior and inferior, posteriorly present in the lobes of thyroid gland. Then what do they secrete? They secrete a hormone called as parathyroid. Then parathyroid, what is the function? It is a hypercalcemic hormone. Hyper increases the level of calcium in the blood. Okay, so increase, that is if hypersecretion of PTH, if the PTH is produced in more than the required quantity, results in demineralization of bones, resulting in softening, bending, fracture of bones. It is called as osteoporosis. It is common in women who reached menopause. Parathyroid gland का position है. We have the thyroid gland labeled in orange. We have superior parathyroid gland labeled in blue. We have inferior parathyroid gland again labeled in blue, but it comes in the thyroid gland. We have hyoid bone. Hyoid bone is a bone that supports the tongue. टंग रहता है ना, टंग को सपोर्ट करना है. टंग के अंदर बोन नहीं है. There is no bone in the tongue, but the tongue is supported by a bone called as hyoid bone. Hyoid bone is the bone that supports the tongue. And the epiglottis. Epiglottis, you are well aware, it is the cartilaginous flap that prevents the entry of food through the glottis into the windpipe. Prevents food. Superior parathyroid, inferior parathyroid, hyoid bone, and the epiglottis. Okay. This diagram एक कैचर लेबल के लिए आ सकता है. Next we have thymus gland. Thymus, thymus gland. This also is a very small gland, but plays a very important role in immunology. Thymus gland. This gland is located on the upper part of thorax, on the dorsal side of heart. This is the position of the thymus gland. Thymus gland is labeled in green, left lobe of thymus and the right lobe of thymus. Thymus gland, right? It is, and many labels are here, but you have to learn the main diagram. That is the left lobe of thymus and the right lobe of thymus. The first rib, left trachea is labeled, thyroid gland is labeled, and laryngeal nerve is labeled. Okay, remember that it is the thymus gland which is more important here. Thymus gland. Thymus gland is located in the upper part of thorax and on the dorsal side of the heart. Heart ka piche, dorsal side of the heart. It is soft pinkish bilobed mass of lymphoid tissues. Lymphoid tissues say. lymph nodes, lymphoid tissues concerned with immunity and the production of antibodies and all stuff. It is soft pinkish bilobed mass of lymphoid tissues. It is prominent gland at the birth but gets atrophied as the age advances. So it is called as a temporary endocrine gland. It is prominent gland at the birth but gets atrophied as the age advances. At the time of birth, it is very prominent, keep on contributing to immunity. As the age advances, this gland gets atrophied, degenerate or shrink हो जाते हैं gland. उसका functions कम हो जाते. As the age advances, this gland shrinks. That means atrophied, degenerates. So it is called a temporary endocrine gland. That is why it is temporary endocrine gland, because it is not going to carry out the function throughout the life. Throughout the life. Thyroid gland, hypothalamus, pituitary gland, adrenal gland, all these glands are going to carry out the function throughout the life. They are permanent endocrine glands, while thymus gland is temporary endocrine gland, because as the age advances, the functioning of this gland stops. Thymus gland secretes a peptide hormone called thymosin. The hormone secreted by this gland is a protein-based hormone. Peptide hormone called as thymosin. Thymosin play an important role in the development of immune system and maturation of T lymphocytes. T, the word T for thymus. It promotes production of antibodies. अभी देखो बॉडी के अंदर दो टाइप का लिम्फोसाइट्स है, एक बी लिम्फोसाइट है, दूसरा टी लिम्फोसाइट है. Where are lymphocytes produced? Lymphocytes are produced in the bone marrow. The lymphocytes which are produced in the bone marrow and matures in the bone marrow, they are called as B lymphocyte, B for bone. The lymphocytes which are produced in the bone marrow and matures in the thymus gland, they are called as T lymphocytes. The word thymus for T for thymus. It promotes the production of antibodies. Body के अंदर antibodies बनता है. That is because of T lymphocytes. It is humoral immunity. Humoral immunity means it is liquid-based immunity. Yeah?
So, hello, sir.
Hello.
So, what is the difference between?
Hello.
Hello, sir. Hello.
Yes, I can hear you. Come on.
So, what is the difference between
please.
antigen and an antibody?
Hello.
Hello.
Difference between?
What is the difference between antigen and antibody?
Antibody
and antigen.
ऐसा पूछा?
Yes. What is the difference between them?
Antigen. You know, antigens, difference itna hai, antigens are, generally speaking, antigens, any substance that enters into the body and which can cause a disease is called as a what? Antigen. Any chemical substances that can enter into the body, or any substance that can enter into the body and can cause diseases, are generally called as antigens. But remember that there is A antigen on RBC, which gives A blood group, B antigen on OBA. Then what are antibodies? Antibodies are protective chemicals. Antibodies are protective chemicals produced by the body in response to an antigen. Antigens, any foreign substance which body considers as a foreign substance which enters into the body is called as an antigen. And the protective chemicals produced by the body in response to an antigen is called as a what? Antibody. Okay. Clear ho gaya kya? Any foreign substance that can enter and which can cause disorder or disease is generally called as an antigen. And the protective chemicals produced by the body in response to an antigen is called as a what? Antibody. Okay, it is a protective chemical and antibody, and it also promotes production of antibodies called humoral immunity. Humoral, HUMORAL आएगा. तरीका humoral immunity promotes production of antibodies. And this is the diagram of it. So that is the thymus gland. Thymus gland is an important one, so a short one. It is present. It is present on the dorsal side of the heart, pinkish gland. Then the main function is to secrete a hormone called as thymosin. Thymosin is essential for the maturation of T lymphocytes, and T lymphocytes are concerned with the production of antibodies. This gland is a temporary gland because it is very active in the infant stages to the childhood. And as the age advances, this gland gets atrophied, it getting degenerated. So it is called as a one temporary endocrine gland. It produces some T lymphocytes. T lymphocytes are the first line of defense. That is why, in very old person has got a very low immunity. Old person में immunity low रहता है क्योंकि T lymphocyte production कम हो जाता है. Why T lymphocyte production is less in their body? Because thymosin is not produced. Why thymosin is not produced? Because thymus gland got atrophied as the age advanced. Okay. So that is the thing here, students. This is the parathyroid gland and thymus gland. We will stop here, students, and I will upload this in the WhatsApp.